Good afternoon. My name is Christopher Lacasse. I am completing a head-to-toe assessment on our voluntary patient here, and I have already walked him through the procedure, but so he is aware of what's going to happen. I apologize. There might be some dogs whining in the background. I'll do my best to keep that to a minimum. Some ahead of time, some tools that I will utilize throughout this assessment. I don't have all of them, so I'll just be verbalizing what I'm doing in lieu of those tools. So I don't have an otoscope. I'll just kind of go through the motions with that and speak about what I'm doing. I don't have a mallet either to test reflexes, so we'll just kind of play along. And otherwise, I do have a stethoscope, I have a pen light, and I do have a set of gloves here. So to get on with our complete physical assessment of the adult male patient, I typically like to work in a top-down fashion. And I like to save the most invasive for the end, which works really well in a top-down situation. So the first part, I'm going to introduce myself to the patient. Hello.
Hello.
How are you today?
Great.
Excellent. My name is Chris. I'm going to be the nurse with you today. Today we're going to do a head-to-toe assessment. I'm going to ask you some general questions to get started. Do you consent to this examination?
Yes.
Excellent. Can you tell me your full name and date of birth, please?
Derek Lipscomb, 3/18/89.
Okay, perfect. And do you know what day of the week it is?
Yeah, it's Tuesday.
And where are you right now?
At home.
Okay, perfect. So I'm just establishing a baseline alertness level with this patient. So he's alert and oriented ×4. He knows who he is, he knows where he is, and he knows why he's here. He also understands the situation at hand. At this point, when I'm first meeting my patient, I'm going to conduct my general appearance assessment, sort of my across the room assessment. If I were working in the ED or in the behavioral health clinic, it's kind of my first impression of the patient. It gives me a great understanding about where they are emotionally as well as psychologically. So I can see from my general appearance assessment that he is well groomed. He takes pride in his appearance. So psychosocially, I can understand that this gentleman typically feels pretty good about himself. He doesn't appear to be struggling with any self-esteem issues. He is able to meet his basic needs. We will go over a little bit more of that throughout the assessment as well. Some just general questions. Can you tell me if you're having any pain anywhere right now?
No.
No pain. So 0 is none, 10 is the worst pain you've ever felt. What number would you rate your pain right now?
0.
0. So perfect. Nowhere in your body is there pain.
Nowhere.
Perfect. So that just eliminates a whole lot right there. If this person were to say, yeah, I have pain 8 out of 10 in my lower back, that gives me a guideline as to where I could do a more focused assessment. But this gentleman says he has no pain right now, so that's excellent. We can move on to further parts of the examination. Now, in your daily living, do you have any tasks that are difficult for you to accomplish?
No.
Are you able to cook for yourself, brush your teeth, get yourself to appointments without any assistance?
Yes.
And when you walk, do you use a cane, a walker, or are you able to walk on your own?
On my own.
Okay, do you have any difficulty completing any of your daily tasks?
No.
Great. So we're fortunate enough for this assessment to have a very healthy young adult male who doesn't have any physical problems. Again, if I were dealing with an elderly patient or somebody that had diminished mental capacity, I would want to tailor the assessment accordingly, making sure that I was asking questions that are easy to understand and trying not to go over and confuse them with too much information. The same with assessing children. You want to keep things short, sweet, and in a language that they can understand. So based on my across the room assessment, we are dealing with a healthy young man who is here for just a general wellness checkup. So I will guide my assessment appropriately. At this point, I will again confirm his name and date of birth, and I will move on to slightly more invasive parts of the examination. So for this, I will perform hand hygiene. I'm going to wash my hands over here with soap and water, making sure that I vigorously scrub for approximately 25 seconds, rinsing thoroughly, and turning off the faucet with a fresh set of paper towels. Once my hand hygiene is completed, I will don a pair of gloves. Do you have any allergies that I need to be aware of? You're not allergic to latex, adhesive, anything like that? Okay. Do you take any prescription medications on a daily basis?
Nope.
Have you ever been diagnosed with any medical conditions?
Nope.
Okay, excellent. Very good. So now with my hands with gloves on to protect the patient, I'm going to start my top-down assessment. So the way that I like to do this, just like it says, top down. I'm going to focus on the head first. So without even touching the patient, I'm going to observe the shape of his head. I'm going to look for symmetry. I'm also going to look for hair growth patterns. Do we have any kind of conditions like alopecia? Do we have a psychological disorder where he might be pulling out his hair? This gentleman, I see none of that. The hair growth is normal. He also does have a beard and mustache. It is well groomed. He takes care of himself. Again, there's no evidence of any alopecia or hair pulling at all. So with my observation documented, I will start to feel his scalp. Now, when I am assessing his scalp, I'm looking for any masses, any soft areas, any lesions, any scars or scabs. Everything here seems very normal. Hair growth is good. Hair is soft. He showers, takes care of himself very well. All of that looks really good. Are you having any pain anywhere that I am palpating up here?
No.
Sorry for using the word palpate. Anywhere that I'm touching up here?
No.
Generally in the assessment, you want to avoid medical jargon at all costs. So hair growth is normal, the shape, the size, the symmetry of the scalp is normal. So now while I'm here, I'm going to continue my assessment moving on down. The next area is going to be here in the neck. Again, I'm going to be assessing for any areas of tenderness. Is there any pain where I'm touching?
No.
Okay, I don't feel any lumps. There's no wounds, lesions, masses. That's all normal. While he's here and we're assessing his neck, I'm just going to ask him to do a few simple range of motion exercises. If he's able to perform these without problems, great. If not, if there's an area where he has difficulty or pain with movement, I'm going to want to assess that a little bit further. Can you do me a favor and can you take your head and tilt it to the right and to the left? Can you take your chin to your chest? And look up at the ceiling. Was there any pain associated with any of that?
No.
Okay, so full range of motion, no pain. Everything is looking great for this gentleman so far. So while we're still in the head, we've done the head, we've done the neck. I'm going to move on to the ears in just a moment, but I'm going to come across to the face right now. So first, again, I'm going to look and I'm going to make sure everything is symmetrical. I'm going to make sure that there isn't two of things that there shouldn't be two of, and make sure that there are two things when there should be. So his face is symmetrical. Can you do me a favor? Can you raise your eyebrows for me like you're surprised? Pinch your eyes shut really tight. Puff up your cheeks like a fish, like a puffer fish, I guess. Good. So what we're doing there is we're testing one of the cranial nerves. Here, while I'm checking his face, I'm also going to palpate and see if he can feel me touching his face. Can you feel me touching your forehead?
Yeah.
Can you feel me touching your face?
Yeah.
Does that feel the same on both sides?
Mm-hmm.
Okay, while we're here and we are touching our patient, I'm going to go ahead and palpate his sinuses, starting with the frontal sinus. I'm going to check to see if there's any firmness, any tenderness. Does that hurt where I'm pressing?
No.
Okay, I'm going to check the maxillary sinuses. So things that I'm going to look for here, firmness, of course, tenderness. If there is firmness, that could point to signs of infection. So we're just going to gently, without harming our patient, palpate here. Is there any pain associated with that?
No.
Okay, we will move on to a further nose assessment in just a little bit. Again, this is just continuing with the head. So while we're on the front of our face, I'm going to next look at his eyes. So before I start shining a light and blinding him, I'm going to ask, do you wear corrective lenses?
Yes.
Do you wear glasses or contacts or both?
Both.
Okay, and are you wearing them right now?
Yes.
And can you see clearly out of both eyes?
Yeah.
Okay, very good. So his eyes are symmetrical. They're moving in the same direction at the same time like they should be, which is great. At this point, I'm going to use my pen light and I'm going to do a quick examination looking at just, not yet the pupil. I'll check pupillary reflex in just a moment. Right now, I'm just going to look at the sclera of his eyes. I want to make sure that they're white, they're not overly bloodshot, which could be a sign of dehydration. They're not jaundiced, which could be a sign of liver issues. So right now, without blinding him, I'm just looking at the sclera, the outside. So we've got nice white clear sclera. Okay, I am going to touch you now and gently I am going to pull down your lids, your lower lids, and I'm just going to check the conjunctiva here. So what I'm looking for is that they're moist and pink. They're not red, they're not dry, they're not cracked, there's no discharge. All of that is very normal on this patient, which is great. So now I'm going to check his pupillary reflex. I'm just going to have you look straight ahead. I'm going to check each eye twice. I'm just going to check and make sure your eyes are accommodating appropriately. Very good. Perfect. And the other side. Perfect. Great. I'm going to have you look at the tip of my pen here and I'm going to bring it closer to your nose. I don't want you to lose sight of the tip of my pen. Okay. Perfect. So as said, the conjunctiva was perfect. There's no discharge. It's pink. It's moist. He does have accommodation. He does have full range of motion in his eyes. Everything with the eye assessment, the head assessment is normal so far. While we're still on the front of his face, I'm going to do a nasal examination. So some things that I'm going to look for when I'm examining his nose are symmetry. I'm going to see, sometimes you can see a deviated septum from the outside, not all the time. I'm going to see if there's any evidence of history of a nasal fracture. Sometimes that can be noticed in the bridge right here. I'm going to have you tilt your head back and look up at the ceiling. I'm going to examine the nostrils. Some things I'm looking for are dryness, discharge, and inside the nose is where you can see deviation of the septum as well. Everything looks nice, clear. Are you able to breathe out of your nose?
Yeah.
Are you feeling like there's any discharge, any stuffiness?
No.
Okay, can you cover one nostril for me and breathe? And the other one. Was that difficult in any way?
No.
Perfect. So the nasal examination is great. Everything is perfectly in line. I struck gold by choosing this patient. We're going to move further on. We're going to do an oral cavity assessment. So before I actually look at the dentition, the tongue, the shape of his mouth, I'm just again going to lay eyes and look at the general appearance. Is it symmetrical? Is one side drooping, which could indicate a stroke, Bell's palsy? Tell me about your eating habits. Are you able to chew food without difficulty?
Yes.
Very good. Have you ever had braces or retainers?
No.
Any history of being diagnosed with teeth grinding or clenching your jaw?
No.
Okay, very good. So lips are nice and pink. They are not dry. They're not cracked. His hydration status is good. I'm going to have you open your mouth up for me and stick out your tongue, please. And at this point, I'm going to see that the tongue is nicely cared for. There's no crusty food. It's moist. And open up, stick out your tongue and say, ah. Okay, very good. So what I'm looking at there is the back of the throat. I'm making sure that it is not overly red, that there's no pus or discharge, that there is no inflammation. He does have all of his teeth. He does obviously take care of his teeth. They're nice and white. There's no food particles stuck in, no food particles in the back of the throat as well. So now, while we're here, before moving on to the throat, the last part of the head that we're going to assess is the ears. Now, do you have any difficulty hearing?
No.
Do you wear hearing aids?
No.
Okay. I'm going to say some things into each ear. It's going to be a whisper test, okay? I'm going to say 2 colors and 1 number, and I'm going to ask you to repeat that, okay?
Red 7 green.
Okay, very good.
Blue 3 yellow.
Perfect. All right, no hearing difficulties. He's able to hear me bilaterally without difficulty, so that's great. Last part of the head assessment we're going to focus on is going to be the neck and the lymphatic system. So what I'm going to look for first on the neck assessment is to make sure that the trachea is midline. If we have a deviated trachea, typically we see that normally in trauma patients, and that's pointing to a tension pneumothorax. I have no concern that this gentleman has a tension pneumo, but we're just going to look for symmetry. I'm going to palpate gently. We have carotid arteries on either side of the neck. It is important not to occlude both of them, but you do want to check for pulses. You want to make sure that they are not bounding, or you want to make sure that they're also absent. So we're going to start on the right side. Nice, regular 2+ pulse, and on the left. Perfect. Nice, regular 2+ pulse bilaterally. While we're down here, we're going to palpate the thyroid as well. So some things that I'm looking for are hypertrophy. I'm also seeing if there are any masses, any lumps, any tenderness. Is there any pain where I'm touching you?
No.
Okay, so you can feel on both sides of the trachea, the thyroid, nice and soft, no firm masses. As expected, this gentleman is young and healthy, and I would expect his thyroid to be the same. So that's great. Last part of the head assessment before we move on is going to be the lymphatic system. I'm going to be palpating different areas of your head. I want you to tell me if there's any pain associated with any of it, okay? Starting up here.
No.
Moving on back behind your ears.
No.
All right, just under your ears here.
No.
Okay, how about back here by your cervical spine?
No.
Okay, how about here under your jaw?
No.
Okay, moving forward under your jaw?
Mm-mm.
Okay, how about here?
Mm-mm.
Okay, coming on down to your neck, anything back here? How about right up in here?
Nope.
Nope. How about over here on top of your clavicle? How about on this side?
Yeah.
All right, and we'll go a little bit deeper. No pain, no tenderness?
Nope.
Okay, so lymphatic system appears to be intact. There's no tenderness, there's no firmness, there's no hard nodules. Everything appears to be draining appropriately, which is great. A good test to do on a patient as well to check hydration status if they are not able to communicate with you very well is you can grab a pinch of the skin right over the clavicle right here. You're going to be looking for tenting. If it stays up when you release, it could be a sign of dehydration. His skin rebounds perfectly. How you doing so far? So far, so good?
Yeah.
All right, no pain, no problems?
No.
Okay, very good. So with the head, neck, and lymphatic system assessed at this point, I'm going to move on to do the thorax assessment. At this point, I'm going to utilize my stethoscope here. I'm going to start with the lungs. Now, you can assess from the front. However, the recommended method of assessment is going to be from the back. Now, I'm going to ask you to just breathe normally for now, and then when I ask you to take a deep breath, I want you to take a nice deep breath in and then exhale. I'm going to be checking 4 different parts of your lungs, okay?
Mm-hmm.
Okay, nice deep breath in. And another one. And another one. And another one. Beautiful. Perfect, clear lung sounds in all quadrants. That's excellent. Have you ever been diagnosed with asthma, COPD, any respiratory disorders? Do you use an inhaler?
No.
Do you smoke?
Yes.
How much do you smoke?
A lot.
Have you ever thought about quitting?
Yeah.
Have you ever sought help to quit smoking?
Yeah.
Okay, if that's something that you're interested in discussing further, we can certainly do that. Next, I'm going to move on to the cardiac assessment of this patient. Now, using the cardiac assessment is a great time to count respirations. I don't have a watch. I do have a clock just over here, so I am going to count the heart for a full minute. I'm also going to count respirations during that time. I'm going to be checking 5-ish different areas of the heart, checking for different sounds in each one. So I am going to start over here and kind of come across and work my way down. I just want you to breathe normally, almost as if I'm not even here. All right, perfect. So S1 and S2 are clearly heard. I do not hear S3, S4. I don't hear any murmurs. I don't hear any rubs. I don't hear any clicks. So that's great. He does have an irregular heart rate though, so I would encourage him to follow up with the cardiologist and have that evaluated a little bit further. Are you having any chest pain right now?
No.
Have you ever been diagnosed with a heart condition?
No.
No, you hesitated.
Well, not diagnosed though.
Okay, but you do have issues with your heart that are undiagnosed.
Yeah.
So again, that is something that I would follow up with a cardiologist on. Since he's not having any chest pain now, do you feel lightheaded, dizzy? Have you ever passed out?
No.
Okay, so I wouldn't say that there's anything acute going on, but probably something chronic that he should get checked out. His respirations are within normal limits. 12 to 20 is normal respiration range. He's at the higher end, he's at about 18, but he is a smoker, so that's to be expected. Let me just make sure I've got that part down. We are going to continue moving further on down to the abdominal assessment. Now, the best way to conduct an abdominal assessment on a patient would be for them to be lying flat, but for the purposes of this assessment, we're just going to kind of go through the motions. There are 4 quadrants to the abdomen, labeled right upper, right lower, left lower, and you will be palpating and percussing and assessing in different areas as well. Before I move on to the abdomen, I just said percussing and I remembered I forgot to percuss the thorax, so I will have you just lean slightly forward. I'm going to take 2 fingers and I'm just going to tap. Basically checking for just sound waves, how it travels through the body. That could give you some insight as to whether there is a mass there, whether there is a fusion, whether there's nothing there, which could indicate a collapsed lung. I don't see any of that as well. So continuing on with the abdominal assessment, are you having any abdominal pain right now?
No.
And how would you describe your bowel movements? How often do you have them?
Normal.
Normal is what for you?
Once a day?
Once a day. And is it difficult for you to pass stool?
No.
It happens easily.
Yes.
Okay. And what would you say the consistency of your stool is? Is it more watery? Is it firm? Is it smooth?
Normal?
Normal for you. Okay.
Yeah.
That's fine. Very good. So before we go on to percussion and palpation of the abdomen, you don't want to disturb anything down there. If I start digging in. It's going to cause some sounds to change. It could move things around a little bit. So the first thing I'm going to do is I'm going to auscultate in all 4 quadrants. Now, for sake of time, I'm not going to listen to each quadrant for a minute. I am going to abbreviate that unless I encounter something which requires a little bit further assessment. So again, for this, just breathe normally. Okay, so during the auscultation part of the abdominal assessment, I hear bowel sounds in all 4 quadrants. I would say that they are approximately 3 to 5 seconds apart, which is in the normal range. If they were happening more frequently, that would be hyperactive bowel. If they were happening less frequently, that would be hypoactive. And depending on what assessment finding in either direction, that would pinpoint my more focused examination. He's having normal bowel movements. He has normal bowel sounds. There's no discharge or blood or anything in your stool. It's normal brown color.
Yeah.
I'm not concerned about anything abdominally with him. I'm going to ask you to put your hands at your side for just a moment. I'm going to palpate, touch your abdomen. I want you to tell me if there's any pain. So in the right upper quadrant, you want to push deep enough where you're going to be able to assess the liver. I can feel it. It's nice and soft, pliable. Some things, if it were firm, you could be looking at ascites, you could be looking at fatty liver. Over on the left, we're going to be looking at the spleen. Everything is nice and soft over here. Any pain where I'm pushing?
No.
Okay, perfect. Down here in the right lower is where you would check for any rebound tenderness. I want you to tell me if there's any pain when I let go.
No.
Okay, perfect. Nice and soft, no pain with palpation or with release. And then in the left lower quadrant, this is where a lot of the times you could find constipation, masses, things of that. No pain anywhere.
No.
Okay, perfect. So now I'm going to just percuss again. Okay, everything looks good so far with this gentleman. While we're on the thorax here, I've done his skin assessment of the head and the neck. I don't want to forget about the arms. I do want to check for any pain, tenderness in the axillary lymph nodes. No pain right there. Okay, very good. Skin is nice and intact, nice pink color. If I had my mallet here, I'm just going to have you hang this. This is where I would check a reflex here to see if he does have reflex movement over here. And then the same thing on the side. Just going to check the axillary lymph nodes and no pain.
No.
Okay, very good. Again, no lesions, no lumps, no pain. I'm going to check his reflexes over here. And there is reflex. And moving on down, I'm going to check his hands. There are no wounds. Everything looks very good. His nails are pretty well manicured. We have 1 second capillary refill on the right. And I'm going to check for his radial pulse on this side. Perfect. +2. I'm going to check his ulnar pulse. Perfect. +1. And I'm going to check the same on the left-hand side. So no wounds, no lesions, well manicured. fast capillary refill +1. I'm going to check a radial pulse +2, ulnar +1, and I just want to check them together to make sure that they're symmetrical. And they are. Perfect. At this point in the assessment, it could tend to get a little bit invasive. We're not going to do that for this part, so I'm just going to ask him some genitourinary questions. How often do you urinate throughout the course of the day?
Oh God, several times.
Okay. What color would you say your urine is?
Nearly clear.
Okay. And would you say that it is like white clear or yellow clear? Is your urine yellow?
Sometimes.
Is it orange? Is it
No.
red?
No.
Is there any pain with urination?
No.
Any discharge?
No.
Are you sexually active?
Yes.
More than one partner?
No.
This is a good opportunity where you can check STI status, if there's any discharge, if the patient is, we're going to not go into the rest of that, but you can dig a little further and get a sexual health history as well as a genitourinary. He is urinating appropriate amount. He has no difficulty urinating. There's no burning. There's no discharge. So I'm going to go say everything is normal for this gentleman. So lastly, I'm going to continue my head to toe assessment, moving a little bit further. I'm going to ask you to just uncross your legs here for just a moment. I'm going to palpate the thighs here. Is there any pain here?
No.
Again, the skin is intact. There's no wounds. There's no lesions. And could you just let your legs hang here and right here? Perfect. Again, this is where if I had a mallet, I would test his knee reflexes by striking just under the patella. And that is a reflex positive response. And there we go. Perfect on that side. So skin is intact. Can you feel me touching both sides?
Yes.
Feels the same on both sides?
Yeah.
Perfect. All that looks great. Moving on further down. I'm kind of out of frame, but that's okay. You can hear my voice. There is no wounds, no lesions, skin is intact. Some areas that I would look at, especially on an elderly patient, I would want to make sure that I was performing the skin assessment with them in bed. I would be turning them. I would be checking any pressure points, their scapula, their shoulder, their elbow, hips, sacrum, knees, ankles. This is a young, healthy gentleman who's not bedbound, so I don't have those concerns to worry about. Lastly, I'm going to come down and check on his feet here, just like I did on the hands. His toes are manicured. We do have +1 capillary refill. I'm going to check pulses down here. I'm going to check his dorsalis pedis on the left. We have got a +2 pulse, and I'm going to check it on the right. +2 pulse, and equal bilaterally. Can you feel me touching both sides of your feet?
Yes.
And does it feel the same on both sides?
Yes.
Okay, perfect. So some things that I could ascertain from checking sensation on lower extremities. If there is weakness on one side or sensation is diminished on one side, that could point to a possible previous stroke. It could also possibly point to a condition like a deep vein thrombosis, cutting off circulation. Certainly if there was any discoloration, any pain, either darkening or reddening of the skin, everything here looks really good as well. So that's going to be my head-to-toe assessment on this gentleman. I appreciate your consent to this assessment, and thank you very much.